On the eve of February 19, 1994, a woman by the name of Gloria Ramirez was rushed to the hospital. Soon enough, anyone who came near her blood lost consciousness. How did her blood turn so poisonous to the point where no one could get near her? Find out in the latest episode of BigFactz, Woman with the Poisonous Blood. Subscribe to our channel and hit the notifications button below for more videos like this. This woman in question was no evil haggard witch living in a cave. She was an ordinary young girl with 2 children and a husband. However, that all changed so quickly on February 19th. She was undergoing a rapid heartbeat and a drop in blood pressure. She was rushed to General Hospital Riverside. The woman could hardly breathe or answer questions. As we mentioned before, Gloria was young, only 31 years old. She also had late-stage cervical cancer, which could have explained her deteriorating condition. But as you will find out later, cancer wasn't the culprit. Doctors and nurses, of course, rushed to Gloria's side to try to save her life. They followed the normal revival procedures. Drugs to bring her vital signs to normal, oxygen to help her breathe, perhaps. Nothing worked. The nurses finally removed Gloria's shirt to apply the defibrillator electrodes since all else had failed. Her skin was spewing out green oil. The medical staff admitted that her mouth had a weird smell coming from it. The nurses placed a syringe on her arm to get a blood sample, but as soon as the skin broke, everyone started smelling pungent ammonia. Her blood even had weird colored particles floating around, which is not normal, even in a patient. The doctor in charge of emergency that night had taken one look at the blood sample and agreed with the nurses something wasn't right at all, and the wrong part had nothing to do with the heart failure. Suddenly, one of the attending nurses started to faint. Another nurse developed breathing problems. Another passed out. When she woke up, she wasn't even able to move her arms or legs. It was a disaster. Plus, it was chaotic. No one could figure out what was going on. But let's start with the start of these happenings with the medical staff, because they would cause a headache for the hospital team later on as well. One nurse passed the blood sample to Julie, the doctor, who was the one to notice very weird particles. We'll address that later. This was when the first nurse fainted and was taken away promptly. Shortly afterwards, the doctor herself started feeling nauseated. She said that she was lightheaded and left the room, and then immediately fainted. Ironically, the third to pass out was a respiratory therapist who was trying to get to Gloria to breathe even slightly better. The legal team got involved after that, sensing a huge lawsuit, which would come. The hospital ordered that all patients in the emergency department be taken outside in the parking lot. Only one skeleton crew had stayed behind to stabilize Gloria, which didn't happen, of course. The total of 6 people became incapacitated while trying to treat Ramirez because they kept having the weirdest symptoms, and they were related all to Gloria herself. And these symptoms were sometimes mild, like shortness of breath and nausea, but sometimes harsh, like temporary paralysis and fainting. Unfortunately, Gloria died that night, but surprisingly after her death, the night at the hospital got weirder. Of course, the poisonous body could not be handled without precautions. A special team arrived in hazmat suits and searched the whole floor for any signs of poisonous gas, toxins, or any other particles. They found nothing. The team gave up the search and put the body in an aluminum-sealed casket. An autopsy was delayed until after a week, and still the team had to wear hazmat suits. The press dubbed Gloria the Toxic Lady, as no one could get near the body without their own body breaking down. Of course, the experts could not point to a definitive cause shortly after her death still. Officials conducted 3 autopsies because they were baffled. One happened a week approximately after her death, then 6 weeks, and then right before her burial as well. A more complete autopsy was conducted on the 25th of March, nearly a month after Gloria had died that night. The team concluded that there were signs of Tylenol, lidocaine, codeine, and Tigon in her system. Tigon might have been the culprit. It is an anti-nausea medication that breaks down amines in the blood, and it's related to ammonia, so it would explain the ammonia smell in Gloria's blood. But the most important part of the report said that Ramirez had huge amounts of dimethyl sulfone in her blood and tissues. The dimethyl sulfone does occur naturally in the human body as it breaks down substances that need breaking down. Once it is created in the body, it disappears quickly after 3 days. However, Gloria's system had so much of the substance inside that after 6 weeks, it was still 3 times the amount it was supposed to be. 3 weeks later, the county announced that Gloria had simply died of heart failure due to kidney failure triggered by cervical cancer. But we did mention that cancer was not the culprit. It was certain that the weird substances in her blood were too low to kill her, even though ammonia and dimethyl sulfone are both highly toxic. It took county officials 2 months to release the body because everyone was scared that people would faint and pass out. The woman's family was furious. Her sister blamed the hospital for keeping the ER in violation of health and safety codes. And while the hospital has been penalized for this before, it was clear that this time it truly wasn't their fault. An investigation was launched, after which it was claimed that the hospital smelled ammonia and fell victim to mass hysteria. Yeah, ammonia is the worst thing to have happen to the hospital. A nurse working that night denied that she had been affected by mass hysteria and stopped the investigation to go through her own medical history and find her medical files. After the exposure, she had to literally spend weeks at the intensive care unit with huge breathing problems and a proverbial tube down her throat. She even developed hepatitis and a vascular necrosis in her knees, which is just a fancy word of saying the situation with her knees was very bad. We expect the officers who were inspecting the case would be feeling justifiably awful by now. The coroner's office reopened the case and finally contacted Lawrence Livermore National Laboratory to help them figure out what exactly went wrong with that poor woman. What they found would shock them to their core. Livermore Labs put forward a theory that Gloria had been using dimethyl sulfoxide, or DMSO, which is a solvent, a powerful one, as a home remedy for pain due to cervical cancer. Users of this substance report that it does have a garlic-like taste in the mouth. Gloria has covered herself from head to toe in this particular cream, which contained dimethyl sulfone, as a possible way to cure her cervical cancer. DMSO was already labeled as highly toxic at the time. The reason for Gloria's use of a toxic substance on her skin goes back all the way to the 1960s. DMSO was the essential oil of that time, a cure-all. Research did show in the 60s that DMSO could relieve anxiety and pain. Athletes would rub DMSO cream whenever their muscles hurt. But soon enough, the hype went away when it was proven that it ruined eyesight. But in the 1970s, it made an underground comeback as a cure for many ailments. At that point, DMSO was banned, but could be obtained in degreasers in stores. Which was worse? DMSO creams were dilute, but degreasers were 99% DMSO. The coroners exposed DMSO to oxygen and had a revelation. The substance converts to dimethyl sulfate, which is infinitely worse than dimethyl sulfone. Let us explain. As a gas, dimethyl sulfate can destroy cells in people's mouths, lungs, and eyes. Yes, literally destroy them. This leads to a whole lot of unsavory symptoms such as convulsions, delirium, paralysis. Of the 20 symptoms that the staff experienced, 19 were for sure matched with dimethyl sulfate poisoning. The medical staff didn't suffer from mass hysteria or stress. They suffered from dimethyl sulfate poisoning. This is the most concrete theory so far. DMSO would even explain the green color that the doctors noted on Gloria's skin and the weird smell from her mouth. But a lot of people use DMSO. What went wrong with Gloria? Scientists predict that her system might have developed an abundance of DMSO because her urinary ducts must have been blocked as her kidney had failed. Oxygen that was administered actually messed her up entirely. That, of course, turned DMSO from dimethyl sulfone to, or DMSO2. This nasty chemical is known to crystallize at room temperature, and manila-colored particles really were observed in Gloria's blood that night. And what is more, the electric shocks that were given to her by the defibrillator would have turned the DMSO2 to DMSO4. This highly toxic version of sulfuric acid is what actually messed up the emergency staff and created all of their symptoms. The Livermore lab attendants published that the change in the temperature of the blood drawn from 98 degrees to 64 degrees could be attributed to this horrible DMS2 to DMS4 conversion that took place at the hospital. However, this has not been confirmed. There is just one fly in the DMSO ointment. The family of Gloria Ramirez says that she had never used DMSO. Why were they lying? Comment below and we'll pin the best one. Like this video and share it with everyone you know. Subscribe to our channel for more videos like this. This was BigFactz, bombifying your mind with crazy hospital stories. Tune in for more.